Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia, and after we've done that, we're gonna do stretching. And if you participate in the stretching, then it's better if you hold this. This is part 2 of the iron deficiency anemia, and in the other parts we did the other ones here with pernicious anemia, sickle cell anemia, and megaloblastic anemia. We're talking about internal anatomy, the blood system, diseases, and this is no medical advice, we're just reading about it. Now, in this part, we want to make a presentation about the iron deficiency anemia. Let's read the thing with the overall description of anemia again. A reduction in the quantity of oxygen carrying hemoglobin in the blood. So anemia is that the hemoglobin which is carrying the oxygen for the body, but there are not so much of them. There are not enough functioning hemoglobin, whatever it even says, hemoglobin, whatever, in the blood. We had here just as a little thing, the part by sickle cell anemia, they were but they were then, because they were abnormal, they were then deformed into a shape of a sickle, if the people were in the need of much oxygen. And when the immune system was attacking the hemoglobin because it had the wrong form and then destroying them, and then to less hemoglobin cells were there. Okay, anemia, too little hemoglobin cells who would carry the oxygen. Anemia is the most common of all the blood diseases and occurs in various forms. Iron deficiency, pernicious, sickle cell, and megaloblastic. And again, now, even as I said when we read the introduction to anemia, as now after this all four singularly or individually, it sounds to me as if there would be a 5th, 6th, 7th, 8th, 10th one. Just not here listed or not found yet. Symptoms. Tiredness. I'm just saying that more or less just for completed. I believe that what is written here is not. This is not a full picture, so I want to say what I believe is a full picture. That's basically why I say it. Tiredness. Symptoms. Tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, palpitation. Still don't know what palpitation is. Pallor of skin, loss of appetite and indigestion. Swelling of ankles in severe cases, chest pain in older patients. Each form of anemia may have 1 or 2 additional symptoms. So iron deficiency anemia. The most common form of anemia, it is caused by a lack of iron in the blood necessary for the production of hemoglobin. Okay, iron deficiency anemia, there's too little iron in the body, is it blood in the body? Too little iron in the body which is necessary to produce the hemoglobin, which would carry oxygen. The condition is aggravated by pregnancy, heavy periods, or any blood loss. Premature babies are very liable. And the iron deficiency anemia gets worse if the people get pregnant, have heavy periods, or otherwise blood loss. Okay, reasons for vision, I think we have them so far. Let's go on. Symptoms: sore tongue and inflammation on the side of the mouth. We're gonna add them so, and dried brittle nails. We're gonna say, what do we say to the symptoms? Maybe we keep the symptoms short. Now, I noticed already a part of this medicine series that we're talking about the symptoms of iron deficiency anemia. These are not the symptoms of iron deficiency. These are the symptoms of iron deficiency anemia. So if we would list now the symptoms, maybe some people understand it as the symptoms of iron deficiency. I would say these symptoms here listed are so grave, or so big, so dire, that I would say these are more symptoms of anemia. But again, this is not medical advice, just what I read here. It seems to me that these are the symptoms of anemia, not of iron deficiency. Iron deficiency can cause anemia, but... So I'm right now thinking, how much do we try to save from these iron deficiency anemia symptoms? Most of them. The symptoms of the iron deficiency anemia are a sore tongue and inflammation on the side of the mouth. Sore tongue, inflammation on the side of the mouth, and dry and brittle nails. And then furthermore, tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, insomnia. Headache and insomnia, palpitation, pallor of skin, loss of appetite and indigestion, swelling of the ankles in severe cases, chest pain in older patients. These are a lot of things to remember. Sore tongue, inflammation of the side of the of mouth, dry and brittle nails, tiredness, shortness of breath, dizziness, disturbed vision, so far so good, headache and insomnia, palpitation, pain, I don't know what pain means, headache and insomnia, palpitation, pale of skin, loss of appetite, indigestion. Pale of skin, loss of appetite, indigestion. Is it really necessary to say them all? These are so many symptoms. They could mean. Let's go back to symptoms later. Causes: loss of blood due to heavy periods or tooth extraction, for example. Okay, it gets worse through pregnancy, heavy periods, or any other type of blood loss. For example, also tooth extraction. So we're going to say that. A diet deficiency in iron, and also it can be caused, other than heavy blood loss, through deficiency in iron, iron intake, iron in the food, diseases of the bowel in which absorption of iron is prevented. But it can be also biologically that the bowel, I don't really know what the bowel is, it's somewhere in the part of the gastrointestinal tract, one part of it, doesn't absorb the iron. Many chronic infections which interfere with blood formation, and they're also, no, I don't get that part. Many chronic infections which interfere with blood formation. If there are other, they say that, but why is there no iron deficiency if it's caused through infections? So we're just going to take the thing apart. If you would say it would be, there are also chronic infections which interfere with the blood formation. Diseases such as gastric ulcer, cancers, and pleas in which there is hidden blood loss. And the blood loss can be also hidden, so not noticed, through a gastric ulcer, cancer, or pleas. Can be also hidden through gastric ulcer, cancer, and pleas. We're not going to be able to do it in this video. And pleas. And it can be also part of rheumatoid arthritis and myxoedema. Rheumatoid arthritis and myxoedema. No, it gets a lot to name, but it's so far so good. Let's go to the symptoms in a little moment. We have a dry and brittle nails and a sore tongue and inflammation of the sides of the mouth. And we had dizziness and headache and palpitation just palpitation. We had pale of skin and insomnia, and then we had also chest pain in older people and disturbed vision. Loss of appetite, indigestion, swelling of the ankles in severe cases. Shortness of breath, tiredness, and insomnia. Complications, none. Really none? When I mean with complications, as we say with other things, with complications, what we say to pericorneous anemia, do we say complications are heart failure, degeneration of the spinal cord, and cancer of the stomach, so I mean direct consequences of it. Treatment in the home, none. If the symptoms are, consult a doctor, examine the patient, take a blood sample if the diagnosis is confirmed, prescribe a course of iron tablets or occasionally iron indigestions. There are for treatment iron tablets, we would say that. Okay? How to prevent it? Ensure that the diet has sufficient quantities of iron. Report any excessive loss of blood to the doctor so that it can be treated before anemia develops. During pregnancy and heavy periods, women should seek medical advice and take iron tablets conscientiously. I don't know what that word is. Is it consequently, or is it consciously, or is it conscientiously? Whatever. Maybe we're going to say actually these two things, a part of the sufficient quantities of iron in the diet. If there's heavy blood loss, maybe a doctor should be consulted to prevent anemia from developing, and also by pregnancy or heavy periods. So that the treatment could be done, which would be in the form of iron tablets or injection. Outlook. Excellent. The condition should be cured within 6 months of treatment. We're going to stay away from it. The book is from the 80s, so maybe there's something changed. Within 6 months of treatment, There are certainly people who are able to get iron faster. I don't know, but maybe it's about the production of hemoglobin, not about the amount of iron in the body. So there are multiple things which we have to consider if we want to explain why 6 months may or may not sufficient. If the underlying cause is diagnosed and treated, anemia is much less likely to recur. We're going to stay a bit away from it. Now, we don't have time to do it. We have just 5 minutes. That's barely enough for stretching. We're going to do another part, and then we're going to do the presentation. Let's go for one moment to the symptoms, but I don't really know if it's really helpful. The dry and brittle nail, and the sore tongue, and inflammation at the sides of the mouth, and the dizziness, and the disturbed vision, and the palpitation, and the pallor of the skin, and in severe cases swollen ankles, and chest pain in elderly people, and then also the insomnia, and the tiredness, and the shortness of breath. I think I have most of them. I'm missing one or two. Loss of appetite and indigestion. Now, that was the medical part. If you were here for medicine, you could go directly to the medicine part, where we will try to make a presentation, basically say most of the information which we have in the book, normal one. If you stay here and participate in the stretching, that is definitely our risk. The legs are standing around a bit more in front of the body, and we're breathing in a little bit outside. And breathe out and go to the side. Breathing in, out of the other side. In and up. Out and down. Now breathe again in. And out, one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, one up. Breathe in and down the rib cage. And out, back into the middle. Breathe again in. And out, one hand slides down the leg. Breathe again in. Out, one arm over. Breathe again in and out the rib cage. Out into the middle. Now we have feet staying together. And breathe in, lift the arms up. And breathe out, one hand down. Breathe in and reach. Breathe in, out. Again in. Out, one hand down. Breathe in and reach. And out the arm up and both down. Now you have your legs standing shoulders apart and no shoulder surface. And we go back, up, front, down, back and back, front and down, and not backwards. Front, up, back, down, and front, up, back and down. And now breathe in and the shoulders up. Breathe out and out, out. Again in. And out. Again in. And out. Now breathe in the arms up. And reach all this with one hand high up and pretend to take an apple hanging high on an apple branch. So turn it a bit around and then turn it a bit out. And now onto the shifter. Legs wide apart, arms to the sides, breathe in. And now shift over to one side just with the upper part of the body. Again in. And out over to the other side. Again in. And out, we're leaning onto the knees. Breathe again in. And out, one shoulder in front. In the back. And out the other one in front. In the back. Out in front. In the back. Out in front. Again in. And out into the hanging down. Breathe in. And out. Again in. And out over the leg. Breathe in. Out over the other leg. Again in. Out into the middle. And out with the front. I keep on hanging down. Breathe in. And out. Again in. And out comes slowly enough and out back up. Back up to the backward shoulder. Have the legs standing out, shoulders wide apart, a bit more. And breathe in and go down. And breathe in and out. Again in. Out. And breathe in, close the legs. And breathe again out. It was researching. Thank you very much, and until next time.